Hi, everyone. This is Michelle Gramoglia, and I am the President and CEO here at Woodland Pond. This is my weekly address for a Tuesday. Today is Tuesday, June 17th, 2025. I wanted to start today with a little bit of feedback that I have received from a very gracious health center loved one, so the spouse of one of our health center residents. She contacted me last evening. She does have my personal cell, and I welcome her contacting me to ask if it was possible for the interest of sharing information, enjoying content, that the calendars and the newsletters for all parts of the community, meaning independent living, skilled nursing, garden view, and assisted living, all be shared with our listserv every month. This is really easy for us to do. We have a constant contact email account and a listserv that has all of our residents, our staff, the loved one email addresses that we have. These things are all on our website, but you know how it is. We all have to get our content in different ways. So we are more than happy to accommodate this request. Just an example of the really easy ways that you can ask us to help with simple solutions. We love your ideas. Please keep them coming. Low-hanging fruit like this is our favorite thing to deal with, and we will take the highest hanging fruit as well. So bring it on, and look forward to those coming into your email inboxes starting in July. Tom wanted me to announce that starting on this Thursday, we are doing our annual concrete repair and replacement work. For those that are not aware, each year we bring in our concrete repair vendor, and more often as needed if there's a safety issue, but generally it's once a year. And any of the concrete elements on campus that need repair are all accumulated into that visit, and then the work gets done. This year, there are some individual concrete slabs in the back by the north wing entrance, some of the bench pads, some other locations on campus, and as well some storm drains that all need replacement. And that will be happening starting on Thursday. Tom didn't mention it, but I assume it's weather permitting. And of course, it rains every day. So maybe it will get postponed, but as of right now, that is scheduled for Thursday. Because of the location of some of these concrete slabs that have to get replaced by the entrances, you may be rerouted. At this point, I don't think there's going to be any significant detours, but if there will be, obviously signs and cones will be put up, and you'll be given a sense as to how long until you can come back through your normal route. Jason has asked me to let you know that we will indeed be doing shuttling for all of the early voting opportunities, and as well the actual voting day next Tuesday for the primaries here in New Paltz. There are a couple of primaries of interest to the residents, certainly. The town supervisor, New Paltz town supervisor primary, and as well there's a county legislature seat that's open that will be available for you to vote for in the primary. If you have not already put in an absentee ballot, we do encourage you to vote however you vote. And you can do that with early voting or with voting on Tuesday. So Woodland Pond will be doing transportation for early voting on Wednesday, tomorrow, from 10 a.m. to 11 a.m. and from 1 p.m. to 2 p.m. On Saturday, we will shuttle from 10 a.m. to 11 a.m. And next Tuesday, we will do from 9 a.m. to 11 a.m. and then 1 to 3 p.m. And it would be very helpful for us to have signups for this, just so we can make sure that we've got adequate number of drivers and transportation vehicles. But please use your voice. One of the things that is most valuable to us here in the United States is our ability to vote. And certainly we are more than happy to make that accommodation so that you can all do that. Tomorrow, we have a management Q&A in the Performing Arts Center, and that's going to go from 1 until 2 p.m. We do have our normal updates and things like that, but I also am going to be taking some time to answer a number of questions that have come up about where we are on the capital campaign, what's next, what can we expect. There is actually a comment in either it came in from the rumor mill or the suggestion box that's pertinent to this discussion. We have been a little bit on ice related to deciding if we were going to proceed with the capital campaign for the Performing Arts Center or not. There's been some movement. I want to update everyone on that tomorrow. So please do plan on joining that. Hopefully we'll have the opportunity to answer questions that you have about where we are in the design process for the Performing Arts Center, what a capital campaign will look like, and what we can expect from a timing perspective on that. Friday, we have the Starlight Trio is coming. They are slated to be in the courtyard again, I guess weather permitting. So we'll see. Maybe we will see the sun one of these days. Okay, so now on to rumor mill. There are several in the box today that sort of all fall into the same category. There are quite a few this week, and I really want to thank you all for that, because this feedback is so instrumental to myself and our team. It really truly helps guide us in terms of being able to understand what's important or what's a concern to the residents. And then the nice thing is it also gives us the opportunity to talk about some of the underlying programs and services that we have in place. And it always makes me wonder, you know, when these kinds of questions come up and there is a very clear answer, how do we get that information into the hands of the residents early on, consistently, without overwhelming you when you first move in? So it's something that we're always continually working on, but you'll see what I mean with these, at least with these first two comments. So the first is that there are numerous people living in independent living who struggle down the hallway, hovering over their walkers, barely able to make it. Why aren't these people moving to AL, assisted living? Isn't that why they came to Woodland Pond? Is anyone on staff evaluating these people? It seems heartless and dangerous to ignore these people's obvious needs. So for whomever submitted this, I do welcome the opportunity to address this. In independent living, we have a set of evolving criteria for residents to be able to safely reside in independent living. It is not precluded from residing in independent living the fact that you might require an assistive device for walking or ambulating. And as a matter of fact, it would be highly discriminatory and in violation of the Americans with Disabilities Act and the Fair Housing Act if we were to require that folks that hover over their walkers, struggle down the hallway, or are barely able to make it, to not be able to reside in independent living on that basis alone. We have a team that is continually evaluating all of our residents at every level of care. We have a sacrosanct meeting on Tuesdays. You will see us in the classroom today at 1 o'clock, if you so choose. And you will see that around the table is just about everyone that needs to be involved from an interdisciplinary perspective. So this is all of your clinical staff, your executive staff, excluding the support folks. So no dining, no maintenance, no environmental services. But you've got Sarah Leonard's entire team. You've got myself, you've got the entire health center team, you've got the rehab department, and every single week we're evaluating and discussing an ever-changing list of residents whose needs are changing at every level of care. So when we see someone that is struggling in the hallway, or when someone comes to us and says, gosh, this person's really struggling, whether it's in independent living, assisted living, memory care, those are the people that are ending up on our list. People are also ending up on the list when we start to have concerns about forgetfulness with appointments. That might come from feedback from concierge, or changes in demeanor that might come from the hostess staff. We do continual visits with all of you, whether it be with Sarah doing her annual visits. Liz Elliott is working with you as in her wellness nurse capacity all the time. Whether you realize it or not, when we are attending committee meetings as a liaison for the management team, or resident council meetings, individualized service plan meetings and assisted living. All of these things are instructive to us in terms of how you are functioning. And if we have any inclination that either physically, mentally, or emotionally your needs are changing and to where you would need some additional intervention, you're going to be on the list of people that we're discussing at our Tuesday meetings. The initial interventions are not move that person to a higher level of care because somebody needs an assistive device. And I completely recognize and empathize with the sentiment that it's very hard for many residents to see what is coming next in terms of aging. And I think that without a doubt, the obvious nature of something like a walker or a mobility device, power mobility, or seeing someone sitting by the fireplace in the main lobby in a wheelchair can be jarring because it's the inevitable insight into what you may be facing. And we are very, very empathetic to that. We are also very empathetic to those residents that have changing needs, but are still functioning just fine in their homes in independent living, or just fine with the assistance in assisted living. And it is always our goal to keep people as independent as possible, as safely as possible. And our team spends an enormous amount of time making sure that you can do that. I would ask whoever wrote this to put yourself in these people's shoes, because that could be you someday. It likely will. You likely will need at some point some sort of assistive device, whether it be hearing aids, a cane, a rolling walker. These are all things that assist you to allow you to be able to stay independent. And it's really important that we focus on cognition, contribution, productivity, demeanor, and try to overlook perhaps the maybe physical, where people are becoming physically compromised. We have interventions in that regard. We certainly make, on a daily basis, we make referrals to residents in every level of care to our outpatient rehab department. They're fantastic. We are the only CCRC in New York State that has a fully staffed inpatient and outpatient physical therapy department. So you're in very, very good hands. And we are not shy to make those referrals. Those also include speech and swallow referrals to the speech language pathologist. So if we have concerns about your ability to communicate, we think that it might be either cognitive or mechanical. If you're experiencing swallowing issues and that's becoming evident in the dining rooms at any level of care, we're making referrals to our speech language pathologist. We have lots of opportunities for other interventions in every level of care, including medication management systems, referrals to you if you might need somebody to help with getting your groceries and those kinds of things. So we do have those interventions. But the most important thing and the most important message that I can share with you about this and the next comment is it is really important that if you see a neighbor that's struggling, or you see someone that you think might be creating an issue on campus, we have to know about who that is specifically. And one thing that we've learned over the last 16 years is when we make a general recommendation, oftentimes it falls on the ears of the people that don't need to hear it, and the people that do need to hear it don't get the message from us. So we need to know who you're seeing and who you're concerned about. Any conversation that you have with Sarah Leonard, or any of our social services staff in the health center, with Liz Elliott, or with the incoming social worker, Annika, that's going to be coming here for independent living. Those conversations are completely confidential. And we need your eyes and ears. So please do continue to bring those observations to us, and we will immediately dispatch someone to go check on the people. We'll discuss those people as a team, make sure that we've implemented any interventions. We're meeting with families. We're engaging the care team, because all of this is expected to happen, right? We're all aging. And so the important thing is not sort of sending folks out to pasture, but to be giving residents the tools that they need to be able to thrive in the most independent living level of care. And to your question about, isn't that why they came to Woodland Pond? I would counter and ask you to consider what I've just said. I don't consider, and I don't think anyone on my team considers, that you come to Woodland Pond so that we can, move you into a higher level of care the minute that a need arises. I feel like one of the benefits of coming to Woodland Pond or a CCRC that's well run is to have a team that's engaged and to be providing you with as many interventions to be able to stay in the level of care that you wish to be in as safely as possible while still meeting our criteria. So I think you're coming to us for the resources, coming to us for the guidance, coming to us for that support, so you can remain as independent living as long as possible, or assisted living, even if you do need a walker, and even if you do lean over it. We still want to help you stay as independent as possible, and I'm confident that there are always tools that we can do that. The next comment falls into the category of, if you see something, say something, because with a comment like this, it's nearly impossible without any details to look into this. But there is, this states, there is a rumor about a man who has been stowing away in one or more of the apartments. Can you please tell me if there's any truth to this? Apparently, he has taken at least 2 of the meals from the takeout table. Thank you. So in speaking with my team, and especially concierge, who mans the door and kind of knows everybody's coming and going, especially since we have so many cameras now and they are viewing the cameras at all times on the side entrances and so forth, no one is aware of a male that is suspected of stowing away, and certainly not in one or more of the apartments. That's very concerning. If you have details on this and you wrote this, or if you are another person that has any concerns or details about this, can you please communicate that with Sarah Leonard or with Jason Irish as quickly as possible. It's not uncommon that our residents do have guests that come and stay overnight. The current policy does allow for overnight guests to be able to stay for up to 2 weeks with advance notification to the community. So it could be a situation where someone is here on a long-term stay. But it's really mostly important that you are communicating specifics to us so that we can confidentially look into them. Okay, the next question, another great opportunity for us to insert some clarity into the sort of how the sausage is made here in certain levels of care at Woodland Pond. This says, most skilled nursing and assisted living facilities have physician specialists, and in parentheses, podiatrist, cardiologist, dentist, optometrist, orthopedist, etc., coming and going throughout the week. Why doesn't Woodland Pond have that? So Woodland Pond currently has a series of physicians that are what is called credentialed to be able to provide service legally in our higher levels of care. That process is initiated by that physician. That physician contacts Woodland Pond and indicates to Woodland Pond, I'm interested in being credentialed. I have these patients here on campus. I am willing to pay the additional medical malpractice insurance to be able to practice in the setting here in the health center. So whether that be assisted living, garden view, or skilled nursing. And then they're subject to a wide variety of background check, licensure verification, character and competency verifications, approval by the medical director, approval by the president and CEO, approval by the administrator of the health center, which is Philip Mail, and approval by our board. The reason that we don't see too many physicians in any, especially in the specialties, is because we're so small. And you're absolutely right. In the larger facilities, you may more often see a dentist or an optometrist come through. It's very unusual in this day and age now that a cardiologist or an orthopedist or anyone like that would come into a campus like this, simply because they don't have the efficiency to meet the requirements of the insurance companies, and whether we like that or not, and that may be an indictment of the insurance and healthcare industry in the United States, but that's the reality. It's very, very inefficient for physicians to come and provide services here, so they like to stay in their offices and see our people when we bring them to them. That being said, Woodland Pond is open to credentialing any physician in any modality that would like to come and provide services. And to the extent that we identified, for example, a recurring doctor that a lot of residents use, we certainly have not hesitated to reach out to them in the past. We do currently have a credentialed podiatrist, that's Dr. Colbert, and he comes once a month and then more often as needed. We did have a credentialed dentist, Dr. Angelillo, and after COVID, the economics of her maintaining an exam room here with full dental equipment did not make sense to her anymore, so her credentialing has lapsed. And that's the same thing that we hear from dermatologists that we've reached out to, certainly eye doctors, neurologists, cardiologists. In addition to being able to come see the patients, they also generally need some kind of diagnostic equipment. And we are a skilled nursing facility. We are an assisted living facility. We are not a hospital. We are not a specialty doctor's office. So oftentimes the tools that they need to do higher level diagnosis just are not available at Woodland Pond. And that is also contributory as to why you don't see the specialists coming in. But all that being said, the fact that they don't come into the campus in no way impedes your ability to receive that level of care. And on any given day, we are sending 5 or 6 residents out to appointments at all kinds of specialties from the health center. So we got a really great mechanism in place to make that happen between our schedulers and Jason's transportation team. So there should never be any issues with you getting the appointments that you need, but there is your answer on the credentialing side. This one says, I hope you will continue your weekly addresses, reminding us of upcoming activities, and that you will comment on the issues residents place in the suggestion box. And what I say to you is thank you, and you got it. I'm happy to do this. The next, the female landscaper, whose name is Moren, incidentally, seems to spend most of her day riding on the noisy / polluting cart back and forth to the storage area on the outskirts of the property. Is there a storage area near the main building that she can use instead, and therefore spend her days doing more needed landscaping? If you were to ever come to basically any meeting of our executive team or any of the planning meetings related to the under consideration renovation and expansion, one thing that you will hear time and time and time again, especially if you talk to Tom Tango or Eric in the facilities department, is when Woodland Pond was designed, it was designed without storage in mind, and that's both inside and outside. You will notice that nowhere on this campus is there a maintenance shop with a garage, for example, for your fleet. We do not have a parking space that is protected for any of our utility vehicles. That is all something that really should have been addressed and accomplished with the original design, but it wasn't. And as you are generally all aware at this point, with the addition of the last 6 cottages, we are now out of property that we can do anything on because of our conservation easement. So certainly with the advent of whatever may happen with expansion, we are not losing sight of the fact that we do need this exact type of storage. And that kind of thing is also being contemplated in our plans. So the short answer is no, we don't have any place to move anything. And I have asked Tom in response to this, though, to work with Maureen to make sure that she's doing things as efficiently as possible and that there aren't unnecessary trips happening, because it certainly is an efficiency issue. And we know that the gas-powered gator definitely irks some people. So if there's ways that we can add efficiency there, we will do that. That ball is now in Tom's court. If you have additional questions about anything in that realm, that is a perfect conversation for the Plant Ops Committee. This says, it seems overdue for Woodland Pond management to contact our local legislators to put pressure on the New York State Department blocking the so needed and long overdue renovations at Woodland Pond. This is why we have local legislators. And you're absolutely right. This is one of the reasons that we have local legislators. This is something that we have discussed extensively at the executive level with our expansion committee, with our attorneys, and based on some current and very optimistic forward-moving steps that have been happening over the last couple of weeks, this is not the step that any of us think is appropriate just yet. Part of the challenge is when you think about legislators, you kind of have to understand where they align in terms of the committees that they work in and sort of what their emphases are. And every legislator comes to things a little bit differently. Some are true advocates for this cause or that cause. They're very interested in the health committee or the education side or whatever it is. And you really have to make sure that your local legislators align with the whatever advocacy you're looking to have done. Woodland Pond is not really in a position with the departure of Kevin Cahill a few years ago to have a strong advocacy voice at the state legislative level. Kevin was very intimately familiar with Woodland Pond. He was a friend of the community. He was continually looking for opportunities for us to access grant funding and things like that. And when he departed his position, whether you agreed with his politics or not, we did lose that level of advocacy at the state level. So with the current legislative staff, this is something that takes years to reestablish. We are a very small community, although it feels big, that typically doesn't have a lot of the issues and problems that some of the things that the legislators are looking at, like affordable housing, food security, access to well-paying jobs, those kinds of things. We don't check a lot of those boxes. So it's a little bit harder for us to get meetings. But that being said, there are other communities in New York State that are in a much different position, and their legislators have been in position for a long time. Particularly in the New York State metro area, you've got a lot of crossover between the different communities and their legislators, and they are all over this. So there have been some very vocal advocates. As you all know, Woodland Pond is not the only community right now that has an application pending. There are 5 or 6. And those that are in the communities that have a very, very strong voice in the New York State legislature have absolutely been ringing those bells. And we can tell you that it's bearing fruit for all of us. So I don't want to belabor it on the weekly address today, but we will give some updates tomorrow at the management Q&A. There is communication happening now with the state. There is a review happening of some of the elements of the application that were on pause. We've got some inroads on the legal side of things. So things are loosening up, and I'll be happy to provide an update tomorrow. But it's also great for you to have the context of how the legislative system works as it relates to CCRCs. All right, 2 more. This I already touched on. What happened to the capital campaign project to fund the new PAC? Couldn't this have been done months ago? We love the momentum. We're very excited about this. It just took some time to come together because, as you know, we were hyper-focused on the phase 1 application, which initially did not include the PAC. That has gotten shelved because of the application pause at the state level. The Performing Arts Center, though, is a standalone design and can be done through an alternate funding source. So in order to make that possibility of a capital campaign as meaningful as possible and as successful as possible, we've needed to do some things to get our ducks really in a row. We want a very good and well-vetted story to tell you as we look at a capital campaign. And that really was predicated on finalizing the design of the Performing Arts Center, including finishes, which was completed last week, making certain furniture selections, making certain audiovisual, acoustical decisions, lots of different things. All of that has come together over the last couple of weeks, and we are now in a much better position. We know what the scope of the project is. We know where the costs are coming in. And so when you think about a capital campaign, there are many phases to that process. And we're now sort of finishing up the research and development phase of what the scope of the capital project is. We are working through sort of I call it a pyramid of giving. That's not the technical term, but in working with Sally Cross, who's on our board and spent her whole career, doing this kind of thing. And then also, we worked with consultants from the summer into the fall last year to kind of lend into this process. You kind of have to have a sense as to, at every level of giving, how many folks are you realistically going to need? What is your goal? You kind of have to set that out. It needs to really be structured. So we've been working on that now that we have the costs in hand. We are also looking at starting to move into the next phase, which will be what's called the silent phase. And I'm going to explain this a little bit more tomorrow. But we need to get our ducks in the row first. And there is going to be an element to allowing the residents to vet some of this independently. And I have not spoken to the Finance Advisory Committee yet, but I do intend to provide financial information to the FAC so that you can kick the tires on the assumptions that we're talking about, because there really are really strong, compelling arguments to get this done now, both from a cost escalation perspective and also the interest savings on if this was to be independently financed and not done through debt financing. So more to come. We'll talk about it a little bit more tomorrow. Okay, the last one, this was a little bit new to me, and quite frankly, I just talked to Phil about it, and he wasn't exactly clear on what the last messaging was on this, so I apologize. I don't have a firm answer on this, but just to share with you, this says, I feel that the order, and that's in quotes, about not being able to have dinner if we are 5 minutes late, very insulting. We are adults here, and at times we are treated as children. No one plans to be late. There are times when a phone call comes in or the bathroom calls and one must respond. We made the choice to live here and expect to be treated as adults. Please stop demeaning us with these unnecessary rules. So the policies and procedures of Woodland Pond are something that comes up a lot. And I'm always interested in the feedback, because the programs that we put in place, unless if they're regulatory or legally required, are generally adopted by a combination of the Residence Council and the executive team, a committee, the Residence Council and the executive team, a committee and the executive team. So there's a lot of resident feedback on all of the policies and procedures that we adopt. The handbook review starts and ends with residents. So there's a ton of feedback. And yes, the book is big. There are a lot of policies. But I've been in many a meeting where a resident has posited, what if we didn't have a policy about where pets can be? What if we didn't have a policy about what time people should be coming and arriving for their reservations? And it's that kind of procedureless or protocol-less environment that would create a lot of consternation and chaos, frankly. When we did not have a reservation system, the kitchen could not adequately keep up with the demand because everybody wanted to come eat at 5:30. And that it can't happen, right? So if we're serving 130 covers or 130 meals for dinner at night, if you're expecting to have a hot, relatively time efficient, enjoyable meal, and all of you and your neighbors may be able to have a seat in the dining room, the kitchen can't do 130 covers within with everyone coming at 5:30. So we moved to a reservation system during COVID, and we had 3 seatings, and those 3 seatings persisted for some time. And then with Phil coming on board and Jared taking his new position in the early fall of last year, the dining committee of the residents worked with Phil and Jared and their team to decide that it was time to move to an every 15-minute reservation system, with also walk-in seats available at certain seatings, to sort of balance this out. But what that does do is it says that if you do come after your reservation was assigned to happen, that you agreed to, we understand that life happens. We're not sending you away from the dining room. We would never, ever do that. We're just asking you to hold tight until the next seating, which is maybe 15 minutes later. Actually, it should be 15 minutes later. So Phil and I are looking at how this may have gone out and been a little bit confusing. We want to make sure that You have access to your meals, of course, and that's the priority for us. And I just want to invite anyone that has any concerns about our policies and procedures to take it to the right committee. The committee meetings are open for a reason. They're for your feedback. Same thing with the Residents Council. They have an ear session. Obviously, we have the suggestion box. So there's lots of different ways that you can give feedback, but all of these things lend into our eventual policies and procedures that we adopt and go into the handbook. And so your feedback is absolutely welcome. And I think everybody would agree that if there were a couple of these policies or procedures that could go away, there wouldn't be anybody here that would be sad about it. I would encourage you to, if you are interested in this, to participate in the next handbook task force. They always need residents. And if you have a concern about this, that is a fantastic way for you to use your voice. That is all that I have for today. Boy, was that a long one. And now I am off to that 1 o'clock meeting to talk about the residents that have changing level of care needs. I hope you all have a great day, and I'll see you next Tuesday.